Welcome to MI Radio's Myanmar Today. I'm Melody and here are today's reports. State Counsellor stresses importance of cooperation to contain spread of COVID-19. Amyotha Hluttaw representatives discuss decline of print media in Myanmar. Elephant camps earn zero income because of closures amid COVID-19. MoHS alerts public to be mindful of locally transmitted cases. Before we get to the reports, let's take a look at the featured local news for today. Former President U Tin Jaw and his wife Do Su Su Luen contributed 3.6 million jets to the National Level Committee on Prevention, Control and Treatment of COVID-19 on Tuesday. Union Minister for Health and Sports, Dr. Myanmar Today, Secretary 2 of the committee, received the donation and returned a certificate of honor. Union Election Commission Chairman Hluttaw received representatives of local civil society organizations at his office in Naypyidaw on Tuesday. The representatives discussed voter education, activities for effective election observation, and a possible scheme to strengthen cooperation among the UEC, its local offices and CSOs. The chairman and officials of UEC explained the preparations and possible facilitations of observations. The second group of medical doctors and nurses volunteered to combat COVID-19 disease in Rakhine State arrived in Sittwe Township by a special flight of Myanmar National Airlines on Tuesday. They were welcomed by Rakhine State Social Affairs Minister Dr. Chan Thar, State Public Health and Medical Services Officer Dr. Sai Win Zolline, Dr. Zol Lin, and officials at the airport. The health workers groups included 3 assistant doctors, 1 dentist, 1 senior nurse for public health, 5 senior nurses, and 12 nurses. The ministry will also arrange transportations for more medical volunteers who want to join the control measures against the pandemic. The special flight also carried COVID-19 medicines and medical supplies. And I believe it's time now for our first report. State Counsellor Daw Aung San Suu Kyi delivered the televised message to the citizens reporting the latest situation of COVID-19 outbreak in Rakhine State on the 24th of August. She asked for the participation of the authorities concerned of respective states and regions, and the citizens to combat the spread together, as the cooperation is the key to curb the virus spread.
Since the first local transmission case was found in Sittwe of Rakhine State on 16 August, anxieties and concerns have risen among the residents of the Rakhine State. To report the latest situation of Rakhine State, where the local transmission occurs, State Counsellor Daw Aung San Suu Kyi, in her capacity as the chairperson of the National Level Central Committee on Prevention, Control and Treatment of COVID-19, delivered a televised speech on 24th August.
We have made arrangements to provide special healthcare and support to Sittwe and adjacent areas. The Ministry of Health and Sports has made very careful arrangements. We will conduct medical checkups on the people in Sittwe and other townships, which might be impacted by the infection spread. We will also provide medical treatment. We will do all that is necessary. We have already adopted special programs. It is to gain public trust by keeping the people informed.
Most of the positive patients show infections from the market and the virus spreads faster. A stay-at-home order was imposed on Sittwe, and anyone coming back from Rakhine to the respective regions and states have to be put into quarantine and be tested if necessary.
At this time, some people in Rakhine State wish to leave the state. They think they will have more safety outside of the state. Once you are infected, it does not matter where you go. The infection will be carried by you. If you remain in Rakhine State, remain within Sittwe, and you remain in the infected area. If you are infected, it will be quicker to detect the virus. treatment could be given. The COVID virus is not incurable. The earlier this virus is detected, the more effective treatment is provided. At the present moment, the borders between states and regions have been closed. The reason we do not want the people from Sidri and from Rakhine State to go out to other areas is that we do not want the virus to spread. All respective regions and states will have to participate effectively in these closures. Closures mean giving protection. I have estimated that the infection spread has started from 16th of August. After that, I have heard that there were some people who went from Sidri to Yangon by plane. If that type of accident has occurred, please contact the nearest health centers. After contacting this, please participate in a tracking interview where you will be asked where you have been and where you have traveled. If needed, they will give you medical treatment immediately.
Anyone who thinks they have been in close contact with the people who have been infected are requested to notify their nearest medical centers, and the citizens are to be careful of visiting strangers who may have come from restricted regions and to report to the authorities as well.
We have designated plans to make surprise inspections in Sidri, and I urge you to comply with it willingly. There is no issue in being tested, but it will be a significant problem if an infected person goes unchecked. We will give everyone equal treatment, so don't worry too much. The important thing is for us to work together. We must keep a calm head and follow the guidelines of the Ministry of Health and Sports.
The medical professionals who proposed to work in the state were assigned and sent by the relief flight. The voluntary groups are participating in necessary aspects and raising public awareness. The Ministry of Health and Sports keep issuing necessary health guidelines.
တနိုင်ငံလုံးမှာ COVID ဒုတိယလိုင်းမဖြစ်အောင်လို့ကျမတို့အားလုံးရဲ့ပူးပေါင်းဆောင်ရွက်ခြင်းအပြင်ဒီဟာကိုကျမတို့ဟန်တာနိုင်
We can all work together to prevent the surge of the second wave in our country. We will protect Rakhine State in addition to the other regions in our nation. Cooperation is the key. We choose neither a faith nor an ethnicity in doing this. We shall give equal assistance to all the people living in the country. I wish for all the citizens to develop this mindset and help each other. In solving the problems of our country, there has been no discrimination with respect to religion or race. All our union citizens should show that they have the desire to protect and take care of all those who are living within the borders of our union.
That's the report on State Counsellor stresses importance of cooperation to contain spread of COVID-19. The second Amyotha Hluttaw held the 11th day meeting of its 17th regular session on Tuesday in Naypyidaw. At the session, the Hluttaw representative raised a question about the planning to prevent the declination and recovery of the print media in the industry.
According to the 2014 Printing and Publishing Law, there are 47 newspapers, 589 journals, and 499 magazines, over 1,753 media publishers, 309 online news agencies have been permitted by the Ministry of Information until the end of July in 2020. At the same time, online news agencies is increasing to 321 ones. The sudden digital revolution and mobile phone revolution are widely spread in the world. The information technology is going to be more developed in the future. In fact, the print media is going to suffer greater losses than now. Even in case of COVID-19, the restriction on the public makes the decline of the print media in international speedily. The second Amyotha Hluttaw held the 11th-day meeting of its 17th regular section on Tuesday, 25th of August in Naypyidaw. At the session, Hluttaw representatives from Sakai Region Constituency 5 raised a question about the plan to prevent the declination and the recovery of the print media in the industry.
ကျွန်တော်မေးလို့တဲ့မိကုံကတော့ဒီနေ့အချိန်မှာသတင်းစာဂျာနယ်မဂ္ဂဇင်းစတဲ့ပုံနှိပ်မီဒီယာတွေဟာဈေးကွက်မှာအရှုံးပေါ်နေပြီးတော့ဆက်လက်ထုတ်ဝေရန်မတတ်နိုင်တော့ပဲ တစ်စောင်းပြီး
Print media such as newspapers, journals, and magazines are at a loss in the market and they are shutting down one after another because they can't keep at the content. So the government needs to consider how to re-establish the print media. Print media, especially private newspapers, journals, and magazines, distribute news in time, educate people, and they take part in exposing injustices since our country was fighting for independence. However, social networks and online media appear recently, and the expenses of media production are getting higher, so that the private print media are shutting down one by one. As the online media and social networks are developing, there are disadvantages like cyberbullying and fake news. The government can help the print media by reducing the tax of printing equipment, machines, and imported items concerning print industry.
The income, which is the main support for a business of a private print media, is depending on the rate of sales and the investments displayed on the newspaper pages. The income grossing from the selling of newspaper is enormously decreasing. The commercial advertisements are also moving to online media, whose audience became widespread, low cost in advertising, but less in restrictions. So the print media is losing the income gross from the advertisement also. As a result, the print media had stopped its publishing one after another. Following the section, Amyotha Hluttaw, Deputy Minister of the Ministry of Information, responded to the asterisk mark questions asked by the Hluttaw representative.
အခြားတစ်ဖက်မှာ digital နည်းပညာအခြေခံတဲ့ online media ခေါ် new media အသစ်များရဲ့အခန်းကဏ္ဍဟာ
On the other hand, the role of new media such as online media is widely spreading and it will also continue its importance. For example, the number of people who are using Facebook, the most popular social media platform in Myanmar, has enormously increased from 22 million to 28 million during January 2020 to July 2020. Most of the print media in Indonesia has already transformed into new media, the online platform. Some are running their publishing in printed form and also the digital form at the same time. There are also some media running their new media successfully in Myanmar, and the print media in Myanmar are also transforming into new media platform, and so do the state-owned media. I'd like to suggest that transforming and surviving as a new media is the only practical and suitable way to the future development of media sector in Myanmar.
Starting from 2013, the mobile phone revolution had started in Myanmar, and the impressive expansion of internet use has left the difficulties for private media, especially the print one. The print media in the international aspect is also facing this common challenge, and so is Myanmar.
That's the report on Amyotha Hluttaw representatives discuss decline of print media in Myanmar. Moving on to the third report. In Myanmar, there are a total of 22 elephant camps where the visitors can ride, feed, and observe the elephants. The elephant camps are aimed at promoting ecotourism, and it was expected to earn more than $800 US income from the visitors coming to the camps. However, the camps have to close because of the outbreak of COVID-19, which leads to zero income for the camps. And the camps are feeding the elephants by getting food from the forest or planting them. And the donors are also welcomed.
In Myanmar, the elephants are the main power in timber extraction from the natural forests. And when the Myanmar timber extraction has been suspended in some areas, the elephants are kept in the camps or resorts. Elephant camps are opened in order to give rest time to the elephants when the timber production is at a halt, to raise public awareness that it is necessary to take care of the elephants, and to give retirement to the elder elephants which cannot walk anymore. In 2014, there were only 5 elephant camps in the whole country, and in 2020, a total of 22 elephant camps have already opened. The elephants are designed for regional ecotourism promotion, where the visitors can ride, feed, and observe the elephants. The entrance fees can be deferred depending on the camps. Since the elephant camps are closed amid COVID-19 outbreak, there have been some difficulties for food as well as the income became zero. Utundun U, Deputy General Manager from Mandalay region of Myanmar Timber Enterprise, said.
Some elephant camps are opened near the forest and some are in the urban areas where the elephants have to move to. For example, Balin Elephant Camp from Sagaing region and Wana and Dido Elephant Camps from Mandalay region have existed in urban areas. Since these camps are not close to the forest, there is a little bit difficulty for food for the elephants. But this is not that bad because the food fed by the public such as corn and cane are just like snacks for them. Their main food is available in the forest. Moreover, we have buffet menu for the elephants, including various fruits such as watermelon, banana, cane, and other foods. We are to continue keeping the elephants here since the transportation is difficult to send them back to the forest, and they are already trained to be clever. We depend on the donation of buffet menu, and we take them to the temporary camp, which is nearer to the forest, to feed the main food. If there is no forest near the town, it is necessary to plant the foods the elephants consume. The elephants remain healthy, but there is no income of riding elephants. The income of the camps and the government is affected.
The income is mainly consumed to take care of the elephants, and in 2017-2018 fiscal years, the total income from the elephant camps was about 320 million JPY. Myanmar Timber Enterprise expected to earn more than 800 million JPY from elephant camps for ecotourism. In December of 2019, 62.1 million JPY was earned, 56 million JPY in January of 2020, and 46 million JPY in February of 2020. Udin Zomo, the beauty manager in charge of Wana Elephant Camp, also said.
Usually, the students come and visit during the December holidays and summer holidays, and especially at weekends, more people come. On the Independence Day, there were 200 people visiting the camp. The camps are stay closed until the government allows us to reopen. When we reopen, we will arrange for health preventative measures such as wearing masks and washing hands.
In Myanmar, the Asian elephants can be found, and the elephants under the age of 18 are working to provide right. Those from the age of 18 to 50 are in logging, and those over 50 years old are given retirement. Ko Tsiao is the mahout of Wanat Elephant Camp, while 3 male and 3 female elephants of the age of 9 to 15 years old are kept, and he said.
All the elephants have already been lured at the age of 4 or 5 years. After that, they are trained with the skill they should have. The elephants which have already trained are not tended to walk for the timber extraction. It is aimed to help closer friendship between humans and elephant, and for the children to see the elephants in practical rather than just in a school book.
There are about 3,100 elephants owned by Myanmar Timber Enterprise and about 2,500 private elephants in the whole country.
That's the report on elephant camps earn zero income because of closures amid COVID-19. Let's move on to the last report for today. Unlike the spread of the COVID-19 in Yangon and other states and regions, Rakhine State has the new COVID-19 strain, which is more infectious, that is fast spreading a larger number of people since the 16th of August. For those infections, the Ministry of Health and Sports already announced the notices and news release for the people to have strong health awareness for the prevention and control of the COVID-19. Many local people have started to be mindful of the infections even though they were careless about it over the previous days.
Unlike the spread of the COVID-19 in Yangon and other states and regions, Rakhine State has the new COVID-19 strain, which is more infectious that is fast spreading a large number of people since 16th of August. For those infections, the Ministry of Health and Sports already announced the notices and a new release for the people to have strong health awareness for the prevention and control of the COVID-19. Dr. Sidolin, the specialist from the Yangon Workers' Hospital, spoke to MI Radio that people need to be cautious about the prevention of the locally transmitted cases by following the rules from the Ministry of Health and Sports.
The people seem to be careless when the locally transmitted cases were not found over the past few days. But the Ministry of Health and Sports keeps on alerting about the possibility of the second wave to the people. As the locally transmitted cases have started occurring in the Rakhine State, the people have become more cautious. The positive cases in Rakhine State have increased day by day from the infected patients. The Rakhine State is close to neighboring countries which have more COVID-19 infected cases like India and Bangladesh. According to the research from medical sector, the COVID-19 virus has been affected by mutation. Due to this mutation, it can be infected very quickly. Some people who have strong immune system don't show the symptoms of the infection, but it can show in the secondary contacts and other closely contacted persons. All our people need to do is to follow the rules and regulations from the Ministry of Health and Sports. Some people even forgot to wear the masks in those previous days. Washing the hands properly and wearing masks is not a very difficult task to do to follow.
In the COVID-19 period, economic and other sectors have been also affected. Since the locally transmitted cases were found out, people have started to be mindful of the possibility of the second wave of the virus. As the new locally transmitted cases were found out in the Rakhine State, the people are very afraid that the locally transmitted cases would take place in the big cities like Yangon and Mandalay. Uchachoton, Region Hluttaw representative from Line Township, Yangon, spoke to MI Radio about the current measures at the quarantine centers in Line Township to prevent the spread of the COVID-19. He said,
The new locally transmitted cases found in Yangon are the people who have been kept in quarantine at the quarantine centers in Line Township. Since they arrived to Yangon, we took them to the quarantine centers. As Yangon is a commercial city, many people came to Yangon, but in this situation, we strictly controlled at the airport and highway bus terminals. We already made a new quarantine centers, and all the people who had come from Sittwe, Rakhine State, have to stay at the quarantine centers. Many medical researchers said the virus was affected by mutation, which could affect quickly, so that we would have to try a lot to control the spread of the infection. To control this situation, public participation is of great importance. They should be mindful of the locally transmitted cases, and they should be alerted to the possibility of the second wave.
In this time of the COVID-19 period in Rakhine, Sittwe, voluntary medical professionals and healthcare workers have started providing their voluntary services in the fight against the COVID-19. There are also many youth organizations which are currently conducting the health awareness campaign against the COVID-19 infections to the residents. Ko Nelinso, communication officer from Green Network Sittwe, spoke to MI Radio about how the current preventive measures against the COVID-19 in Sittwe as the Green Network. He said,
mass campaign
To prevent and to share the current information about the COVID-19, we are going to launch the mass campaign and share the health knowledge about the COVID-19, especially with the workers and the poor people. We are also going to share the ways how to wash the hands and to wear the masks with the residents systematically. We are also going to spray the pesticides to the Sittwe Township with the financial help from some benefactors. In the current situation, we have got the updated COVID-19 information from the Ministry of Health and Sports in Sittwe. But the other townships in Rakhine like Hluttaw and Mrau have weak internet connections and can't get the updated information. The people in Sittwe are also worried about the infections as there are fewer medical supplies while the health workers are trying their best. People are also afraid of the infections in the IDP camps because the officials have already closed the camps. We have also seen many people in Sittwe following the rules like wearing masks whenever they go out.
Around the world, over 23 million people are afflicting from the COVID-19, with 816,000 deaths and more than 16 million people are recovered on the morning of 25 August. There are a total of 574 COVID-19 patients in Myanmar, with 341 recoveries with 6 deaths, as of the data released from the Ministry of Health and Sports as of 8 a.m. on 26 August.
That's the report on MoHS alerts public to be mindful of locally transmitted cases. Now to international news. State news agency KCNA on Wednesday said the leader of the Democratic People's Republic of Korea, Kim Jong-un, has called for prevention efforts against the novel coronavirus and a typhoon. An enlarged Politburo meeting of the Workers' Party of Korea took place amid a pandemic that is putting additional pressure on the DPRK's economy, battered by recent border closures and flood damage. The meeting assessed some defects in the state emergency anti-epidemic work for checking the inroads of the malignant virus, KCNA said in a statement. The DPRK has not reported any confirmed cases of the novel coronavirus, but Kim said last month that the virus, quote, could be said to have entered, end quote, the country and imposed a lockdown after a man was reported to have symptoms. Flash floods caused by heavy rainfalls have wreaked havoc on low-lying areas in northern Thailand, government officials stated on Tuesday. Villages, farmlands, roads, and bridges across the capital district, Sisamarong district, Sawankalok district, and Kongkralet district of Sukhothai province, about 426 kilometers north of Bangkok, were reported on Tuesday to have been severely hit by flooding. According to local officials of the Department of Disaster Prevention and Mitigation, the areas severely affected were reported to be in the capital district of the northern province, where 1,300-meter-long riverside embankments and bridges have collapsed. Government officials and volunteers have used boats to evacuate flood victims from the low-lying terrains. Responding to an outcry from medical experts, U.S. Food and Drug Administration Commissioner Stephen Hahn on Tuesday apologized for overstating the life-saving benefits of treating COVID-19 patients with convalescent plasma. Scientists and medical experts have been pushing back against the claims about the treatment since President Donald Trump's announcement on Sunday, and that the FDA had decided to issue emergency authorization for the plasma, taken from patients who have recovered from the coronavirus and rich in disease-fighting antibodies. President Trump hailed the decision as a historic breakthrough, even though the treatment's value has not been established. The announcement on the eve of Trump's Republican National Convention raised suspicions that it was politically motivated to offset critics of the president's handling of the pandemic. Hahn had echoed Trump in saying that 35 more people out of 100 would survive the coronavirus if they were treated with the plasma. That claim vastly overstated preliminary findings of Mayo Clinic observations. Hahn's mea culpa comes at a critical moment for the FDA, which under intense pressure from the White House is responsible for deciding whether upcoming vaccines are safe and effective in preventing COVID-19. The 35% figure drew condemnation from other scientists and some former FDA officials, who called on Hahn to correct the record. That's all with the news and reports on Myanmar Today. Hope everyone is staying safe.